Perfect. Okay. Okay. Hi, I'm Lindsey Haynes-Maslow. I'm an associate professor and extension specialist in the Department of Agricultural and Human Sciences. And I'm going to be talking today about food insecurity in North Carolina. And I call this talk Hiding in Hunger because oftentimes we don't always know that maybe our friends and or family members are food insecure. And really, what does that look like? Who's most at risk? And how does that impact our communities and our state as a whole? So I'm going to start off first by saying that North Carolina, while we are one of the top 10 agricultural producing states in the country, we also were in the top 10 for food insecurity. This is a statistic and a ranking that has not changed in over a decade. So we've continued to be top 10 in agricultural producing and agricultural production, but we've also continued to be in the top 10 among food insecurity. So it's a very interesting aspect in that, well, while we grow enough food in this state, there is a disconnect between who gets that food, how we get that food, and then also how do we address making sure that our state is able to feed all the people that we have in our state. So I do like to start off, I know definitions can be boring, but I will give a definition and then also try to give an idea of what this looks like. So the U.S. Department of Agriculture really defines food security as having access by all people at all times to enough food for an active, healthy life. This is the goal that everybody should have this, that again, food should be available for people at any time they need it, and in order for them to be productive in their home, at their work, and also just in their personal lifestyles. In North Carolina, though, we have 13 congressional districts that are on this map that you can see. And I always like to highlight where we have the highest food insecurity rates in our state. And most of the times it is in the eastern part of our state. And I'm going to highlight this real quick. So right there in Congressional District 1, so the northeastern part of North Carolina, that is the highest food insecurity rate. It's almost about 25% of the population is, the 25% of their children in those areas are food insecure. So again, you think about 25%, that's about one in 5 kids being food insecure. The 3rd and 7th congressional districts, which are again the eastern part of North Carolina, those have again some of the highest food insecurity rates in our state. I also like to show this map because the lowest food insecurity rate, and I don't think this would be a shock to anybody, is in the 4th congressional district. So this district includes Chapel Hill, it's got Carrboro, it has Raleigh, it has a lot of your more college educated and higher income or middle income families. So this is really, it shows you that resources, education, and the communities that are in these congressional districts, they do impact how food insecure your area is. So again, looking at, we are in the Research Triangle area. Raleigh is a part of this 4th congressional district. And so as a university, we are in an area with a very low food insecurity rate. However, I think since the pandemic, and I'll get into this a little bit more, whatever rates we're seeing right now, they've been exacerbated by the pandemic. So we've only been seeing these go in a direction that we don't want to see, because increasing food insecurity rates is not good for anybody. Now, I will say food insecurity is one thing, but most of the times when I'm out in the community, I talk about food insecurity and I say the word hunger. And I remember I was doing an interview with a woman and she was talking about experiencing food insecurity and hunger growing up. And she said, well, I just, I know how to look for hunger, or, we know what hunger looks like. And I actually had to stop in the interview and I said, actually, what does hunger look like? Because looking at me, do you know if I'm hungry? I don't know. I did just have lunch. So it's hard to know who is hungry because just a face and even looking at someone you really don't know. So when I asked her, what does hunger look like? This is a long slide, but this was a single mom, and she was talking about her daughter and teaching her daughter how to pick up on little signs. She told her daughter, if you bring your girlfriends around, just pick up on little signs. pay attention and notice that some of them might be hungry. Some people might be afraid to tell you that they're hungry. So she always tells her daughter, when you invite friends over, ask them if they would like anything to eat. See if they're looking on the countertops for food. Are they looking at the fridge? And also, if you're going to give food away, she talked about giving food away as giving food away with dignity. So making it seem like you're not giving a handout, but they would be helping you if you ate food. So the daughter mentions that, she'll tell her friends that, well, my mom put stuff in the Tupperware bowl, we're not going to eat it. It's extra. You can have it. So they make it feel comfortable. And it's like, you're doing me a favor by taking this food. And also the mom would always, put some food out, and she would watch how quickly the child would eat food. Now, in this example, she says, she gives some children some chips, and she'll see how quickly they eat the chips. And if they eat them really fast, then she'll start giving them something else, recognizing this. And this really was taught to her by her own mother and grandmother. And as she says in the very last sentence of this, is she said, because growing up, my grandma used to feed us like that. I would have company, and a lot of my girlfriends were very hungry or went days without food, and it was something that they were scared to let me know or they were afraid of. So as we are speaking right now, you may or may not have a friend or a family member that's hungry, and they may or may not feel comfortable telling you. So if you do, sense some of those things, you can maybe try to use some of these. Obviously, I know we're in a pandemic, so making sure that we're practicing, public health and making sure that we're being safe, but try to see it and take note of if someone is really looking around for extra food, or if they are, maybe, saying, well, I had to skip lunch, or I didn't have lunch. Again, just making sure it doesn't seem like you're giving a handout, but again, they're there helping you, is essentially what this quote really gets at. So, and the other question is really, why do people hide their hunger? If someone's hungry, if I was hungry, I would have no problem asking, someone, hey, I forgot my lunch today. Do you have anything? Can I have a snack, or can I have this? I will say in normal times, I would have no problem asking, hey, I forgot this. But there are several reasons people hide their hunger. And the first biggest thing is stigma and embarrassment. It's not a fun thing to say that you haven't had a meal for a couple of days, or the last time you had lunch was, a week ago. You've only been eating dinners for the last week, or maybe your dinner was, we make jokes about, ramen noodles with college students, but ramen noodles is maybe not the most fulfilling meal you can have. It's high in sodium. It's high in calories, but they're not, we call them, much more, empty calories. You want to make sure you have nutrients. So also recognizing that, that image of hunger, we always think of maybe a child in Africa that's starving. Well, you can also not be, a very super underweight child or adult. You can still be a normal weight or even overweight individual and still be hungry or food insecure. And then also we talk about pride and the fear of community shaming and blaming. So I think this is a really big thing that comes out in the South. We are in North Carolina, and people are very, they have a lot of pride. They feel like they don't want that handout. They don't need assistance. They don't want to ask for help, because if they do that, then they have a fear of the community's going to shame them. Well, you should have made better choices, or, maybe you should have thought about doing X instead of doing Y. And getting that blame of, well, the reason you can't fill your fridge with food is because, you didn't get this type of degree, or you didn't go to college, or, a lot of you statements. And so there's that fear of getting those type of statements from the community and getting that sense of judgment. And lastly, and this is probably, I think, maybe one of the saddest things to this, is some people don't know what it doesn't feel like to not be hungry. So in that example, if I grew up as a child in a food insecure household, maybe I think that's the norm. Maybe I don't know what it doesn't feel like to be hungry. I think that is something that we need to recognize, that, not everybody has the same background as we do. We all do. We grew up in different households. We maybe grew up in different cultures, different states, different countries. And so again, recognizing recognizing that if people don't know that feeling hungry, they should not be feeling hungry, they should not be food insecure, that's not the norm. We have to figure out how can we change this narrative, and how can we also make people know that that's not the norm. We don't want America to be a country where we can't feed our own. So, and I think, going back to, why should we even care about food insecurity? Why should we care about hunger? So one, we know that individuals that are food insecure, they don't eat as many fruits and vegetables. So this is actually really important for North Carolina because we actually grow a lot of fruits and vegetables in this state. So while it's important to consume fruits and vegetables, it's also helpful for our farmers that grow these types of items as well, and to actually earn a living off of selling fruits and vegetables. We also know that food insecurity is linked to a lot of diet-related chronic diseases. So chronic diseases like type 2 diabetes, or you can have heart disease. Later on in life, you can have stroke. It's also linked to some cancers. We also know, as I mentioned on the previous slide, if you are food insecure as a child, that can lead to social exclusion. Maybe other kids are having fun, buying their lunches at school, and maybe you brought your lunch from home, or maybe you don't have lunch at all. So children that have to deal with being excluded from their friends is really can be traumatizing, and that can carry on with them as they get older. We also know that food insecurity is linked with poor mental health and physical health, both in children and adults. Within children, we know that food insecurity causes behavioral, emotional, and also academic barriers for them. There are studies that show when at the beginning of the month, when children have received food assistance, and they've received food assistance in the forms of SNAP or the Supplemental Nutrition Assistance Program, also known as food stamps, they test higher at the beginning of the month, and at the end of the month, when their food stamps or their SNAP benefits, their family's SNAP benefits are running low or already exhausted since they've used them all, their test scores are actually lower. So again, we know that test scores are linked to academic achievement, which is linked to your ability to secure a job, and a really good job that you're able to provide. And lastly, again, diet-related chronic disease is very expensive in terms of our healthcare system and treating these. So it increases healthcare costs. So hunger in North Carolina, really, who's most at risk? And this is all pre-pandemic numbers. But as I showed in the very kind of first slide, is in general, children in North Carolina, we have on average, if you average out all of those numbers from that original slide, we have about 1 in 5 children that are food insecure in North Carolina. And those were pre-pandemic numbers. So those numbers have only increased. We also know that communities of color, specifically Black and Latinx households, are more than twice as likely to be food insecure than white households. Black or African American households have about over 21% food insecurity rates. Latinx households, nearly 20%, and then white households are under 10%. They're at 7.8%. We also know that rural communities are actually more likely to experience food insecurity than urban communities. And while that difference is not as big as the race and ethnicity breakdown, it still is a few percentage points, which again, we always need to focus on. Not always, hunger can be everywhere. It doesn't respect boundaries. So you can be in a rural community or an urban community or suburban community. And again, you never know who really is hungry at all times. So we did do over the summer, we did an online survey with adults exploring the impact on COVID-19 and food security in North Carolina. And these are the geographic locations of the participants we had. We had almost 400 people respond, and those dots are just where they inserted their zip code. So one dot can be maybe 25 people from that zip code responded, or maybe one dot is only one person. Now, what you see within this map is obviously we didn't get great representation from Western North Carolina, but also those are the mountains. They don't have great internet access. I will say Eastern North Carolina also doesn't have great internet access, but there are more pockets of places that people can, drive to or be near a store or an office or something that offers internet access. When we surveyed people, we asked the U.S. Department of Agriculture. They have a 6-question food security screener, and you have 6 questions, and these are, and I'll read them real quick, but one is, the food that my household bought just didn't last and we didn't have money to get more. And people can say that's often true, sometimes true, or never true. Now, ideally, what you want to see in all these questions is you want people to say never true. That means that they are food secure, that we're not worried about that. If they say sometimes or often true, that's getting into kind of a scary territory of, okay, if it's sometimes true, you may be food insecure, or if it's often true, you're probably going to be food insecure. And the other questions we asked are, I couldn't afford to eat balanced meals. And then also, have you ever cut the size of your meals or skip meals because there wasn't enough money for more food? And then did you ever eat less than you felt you should because there wasn't enough money for food? Were you ever hungry but didn't eat because there wasn't enough money for food? And then how often would you say you were worried or stressed about having enough money to buy nutritious meals? And what we did was we looked at answers. We asked people, before the pandemic, how did you feel? Like, how would you respond to this? And during the pandemic, how do you feel now? And as I said, when you look at these responses, the often true, sometimes true, never true, you want to make sure the never true is the large portion of the numbers. Well, what we saw is the never true, most of those numbers changed in the wrong direction. And I put in red the areas that actually increased. So you can see that before the pandemic, 86% of people said, they cut the size of the meal or they skipped a meal because they didn't think there was enough money for more food. Well, during the pandemic, that dropped from 86% to 78%. So that direction is trending in the wrong way. Now, on the often true side, and this is probably the scariest one, it almost tripled, but the very first question was, the food that my household bought just didn't last. Before the pandemic, that was 1.8%, and it jumped to 7%. And we took this, and like I said, we distributed in the summer of the pandemic. So this is only a few months into the pandemic. Now you're thinking, we're a year into this pandemic, where are these numbers now? So again, this is something really important, and recognizing that how we look at the pandemic, how it's impacted our food system, how we've had disruptions and supply chain issues, how did that impact the families and communities that we're working with? And just a little update on SNAP or food stamp participation in North Carolina. Pre-pandemic, our SNAP participation rates were actually decreasing. A lot of people were getting off the SNAP program in North Carolina. Well, since January 2020, there's been about a 12.5% increase in SNAP participation rate. So that equates to about 1 in 7 North Carolinians being on the SNAP program. So this, I assume, will continue to probably rise as we continue with the pandemic, and if people aren't able to get back and working, and also still dealing with other issues related to, maybe again, job loss or economic issues. So what I think is really important too, as well, is right now what you're experiencing and what we're all experiencing is a public health emergency. It's an international public health emergency. And so why would food be connected with an airborne virus? To me, for some people, that seems like two totally separate categories. Well, food insecurity and COVID-19 actually are fairly related in terms of how that can impact you. So what you think about in food insecurity is those that are food insecure are probably more likely to have experienced discrimination in employment and education. They may have substandard housing, so maybe they don't have a full-size fridge. Maybe they don't have a working oven or a working stove. Also, there are barriers to accessing high-quality quality healthcare. So maybe they don't have health insurance or they're underinsured. So even if they are food insecure, maybe if they do have diet-related chronic diseases, they don't have enough money to go see a healthcare provider to address their issue. Also, we have neighborhood designs that really don't make safe places to be active. So I know that's not a food-specific issue, but usually neighborhoods that don't have, trails and parks, those are usually the same neighborhoods where you see a lot of fast food restaurants or a lot of maybe not as many venues to buy healthy food. As that feeds into the next kind of loophole there, which is neighborhoods lack access to healthy foods. So all of those factors combined will increase people's risk for obesity, type 2 diabetes, food insecurity, heart disease, stroke, and some cancers. And as I've kind of shown here, all of those issues or medical conditions exacerbate COVID-19. So if you have any one of those pre-existing conditions, that can increase your chance for getting COVID-19. It can increase the severity or how long you experience COVID-19 or your symptoms. It can also increase your chances of having to be hospitalized. And lastly, it increases your chance for possibly passing away from COVID-19 due to complications from COVID-19 and these diet-related chronic diseases. So I think also what's important, because this is, a student talk, and I always don't want to just list all the problems, but what can you do about it? So really, I think students are great individuals and great resources to build awareness in the community and build support for an issue. So talking about food insecurity, talking about food systems, talking about how, viruses and food insecurity doesn't respect boundaries or state borders. Anybody can be impacted by it. And also looking around your community. What does your community look like? Does it need to be improved? Are there places where you could see maybe having an option for a healthy food stand? Or is there an opportunity for a local farmer to come in? And then putting together an action plan. If you decide you want to do something and you want to do a project or initiative, develop an action plan and figure out who you need on board. What resources do you need? What people do you need? How much time is this going to take? And then explore those resources to see what's going to happen. And my favorite part is really taking action. So really addressing the issues head on, using that action plan to guide what you do. And then in every project that you do, if any type of win that you have or any type of success that you have, you want to make sure you celebrate it, because change takes time, but it's always important to celebrate those small steps or the small changes you can make. And I do think, I know we're a year into this, but I do think that COVID-19 and food insecurity and really thinking about food systems as well as sustainable, agricultural, and looking at all of our new windows of opportunity. Every cloud has a silver lining. So when we undergo crises, most people and societies end up creating opportunities to test new and novel ideas. So I want to leave you with a note that this is really a time for you to think about if you have an idea, if you want to test something, if you want to work on a project, now is really a perfect time, because now is when people are open to those ideas. Because when you are in situations where you need to act and you need to do something about it, people are more receptive to that, and it can bring people together around an issue or a campaign or something like that. But I know we don't have too many people on the call right now, but I am happy to answer any questions right now. Then I'll wait for about a minute or two, and then not. I'm also always happy to answer questions via email.
So I apologize, I called in late. So you might have already said this, and if so, I apologize. But are you planning on doing more of those surveys, like to follow up as far as where things are now?
Yeah, so I'm working with a team, and this is being led by a professor in the Department of Sociology, Dr. Sarah Bowen, and then also another professor in my department, Dr. Annie Hardison Moody. They actually are conducting interviews with a lot of North Carolina-based families, as well as this is a multi-state study. So a survey is only as good as, the answers that people respond. So what their project is being funded by the National Science Foundation, and really following up with people and doing in-depth interviews about their experiences during the pandemic. So they are following up with more a qualitative approach to this survey than what we did originally. I would be really curious if we could repeat this, in May or June, because that's when we did the original survey, would we get, different responses? How would people respond differently, and which way? Would we start looking better because we're a year and a half out of it, or are we still, not looking as great with the numbers? But that's a great question. Great. Well, and I checked the chat box. I don't see any questions in the chat box. Like I said, if you have any questions, I'm Lindsey Haynes-Maslow, and hopefully, if my email, I think, was at the very beginning, and if not, I believe that if you just Google me, my NC State email will probably show up. But I'm always happy to answer any questions, or if you want to make a comment, I also welcome feedback.
Thank you so much.
Okay, thank you.